I'm Howard Thompson, and I have been in the pastorate for 50 years. Pastored churches all over Alabama and in D.C. and right out of D.C. while I was in the Army. I pastored for 16 months and have been involved in music all my life. First time I ever sang publicly, I was in the second grade at school. I've done 10 albums, or projects as they call them now, but I'm still the old school, I guess. I guess the initial problem was some blood in my urine, and a couple of times, and I had an appointment with my regular doctor the next week, and so told him about it. He said, "We can't fool with this. We've got to deal with it." And he sent me to Renneker, and Dr. Renneker ran some tests, of course, went into my bladder and found out that it was a tumor. It was malignant. I had a massive tumor, but I think he said there was about 7 actual tumors there. And he removed those, and then sometime later it came back. In 2011, they found it again. It was a different type of tumor, and so I had to go back and do that again and check this, did a biopsy on it, found out it was malignant, and so then they scheduled, he did not do surgery, Dr. Renneker did not do surgery any longer, so he recommended that I go to Dr. Bivins, and I did, and he took care of me. I was in surgery for about 8 hours. They found that my previous bladder cancer had somehow gotten into the tubes between my bladder and my kidneys, and so they had to redo the tubes and all kind of things with that. But I had no problems after that as far as soreness was concerned. I had no pain to amount to anything. The recovery was fine. I had some intestinal problems, which I usually have when they put me to sleep, and they'd had me asleep about 8 hours with that, and so I had some difficulties after that, and then had a reaction to a little medication in the hospital. But other than that, I had no problems whatsoever with that, and I was very pleased with the robotic surgery. I don't have any scars, got one little one, and that's about it. They removed my entire bladder. I have a bag outside and everything, ostomy, and it's fine, working fine. Since I have the bag on the outside, it has to be changed about every 4 to 5 days is what we do, and then it's supposed to be emptied, I think, when it's close to maybe a third to half full. But I've had no problems with this. I have no problems emptying it, and it's fine, works fine, and takes care of things. Well, as far as my fluid intake is concerned, I haven't changed it at all. I drink more milk than I do anything else, and they say that's not good with this kind of situation, but I haven't changed that either. Maybe I should, but I haven't. And it's been fine, it's worked fine. I drink very little water, but I have a lot of liquids, drink some tea. I'm a coffee addict, and these things, I haven't changed any of that. It's been fine. Sir, I was raised on a hillside behind a mule on a farm, and I've got the farm now without the mule, and there's been nothing that I can't do. I can lift, I can use my tractor, I plow, I hoe, I have what I call a push plow, and I tell people my mule gets tired with that because I'm the mule, but I've had no restrictions on anything. No restrictions. I had a few weeks after my surgery where I had some difficulty breathing, but I also have lung cancer and had a lung removed in 2010, and there was some kind of reaction in relation to that after my bladder surgery in 2011. So it had been basically a year. I had the lung surgery in April of 2010 and had this in May of 2011. So, but I reckon from the surgery or something caused a little problem with my breathing. I was a little short of breath, these things. But other than that, I've had no problems at all. I'm back to singing, doing whatever I want to do now, preaching like I'm supposed to, and have no difficulty breathing at all. My experience with the staff has been tremendous. I was very impressed with Dr. Bivins, with his professionalism. He's been open and out front with me. He spent all kind of time he sent my, I guess, slides or whatever they do after they do the biopsies. He sent these to several other hospitals and doctors to check out, be sure He told me up front, said, I have no problems whatsoever you getting a second opinion if you want it. I'll be glad to help you arrange that if you'd like that. But I told him, with what he had done and what he had done for me up to that particular point, I was not interested in anybody else. He checked this out, done everything he knew to do, and I was perfectly satisfied and content for him to do my surgery, and I had no anxiety about it. I just felt like he was the man who needed to do it.